My name is Dr. Martin, and one of the services we offer at Auburn Optical is retinal imaging. And oftentimes patients will ask me if it's worth doing, and I always tell them it's absolutely worth doing, and it's because we do it differently here at Auburn Optical. So I'm going to walk you through what we do with each patient that chooses to do retinal imaging in our office. So I'm going to give you the presentation as if you were the patient and I'm going over your retina. So let's do that together. The first thing that I want to do is I want you to think of this as a basketball. Imagine an eyeball right here in space. The cornea is the front surface of your eye. The lens in your eye is here, and now we're looking all the way into the retina. So let's go through this together. The first area that we're going to look at when we look at the retina is an area that we call the optic nerve. Now, the optic nerve attaches the eyeball to the brain. So imagine the brain being behind the computer. When we look at the optic nerve, this is an area that we can see a lot of different things. One of the things that we absolutely look for at the optic nerve is glaucoma. So when we look for glaucoma, we compare the inside diameter that we call the cup to the overall diameter that we call the disc, and that helps tell us whether or not you have glaucoma. This is also where we look for a lot of neurological concerns like papilledema, pseudotumor cerebri, multiple sclerosis can all show up at the optic nerve edge where the retina meets the optic nerve. We call that the neuroretinal rim. This particular optic nerve looks lovely without any signs of any glaucoma and without any signs of any of the other things that we've already spoken about. The next area that we're going to look at are the blood vessels. What's really amazing about the blood vessels is we can look directly at the blood vessels without any adventitia or tissue covering them. Therefore, we can directly see things like diabetes. We can directly see things like high blood pressure. Diabetes will show up as leaking blood and leaking serous fluid. And high blood pressure shows up as what we call vessel caliber changes, where the blood vessels will go thick, thin, and then sometimes the blood vessel will cross another one and cut off the flow of blood in the bottom blood vessel. What's cool about retinal imaging is if we take the time with the patients that we do, we can discuss what to look for, what we're looking for, what diseases we're concerned about. In this particular patient, he looks absolutely fantastic with no signs of any diabetes and no signs of any high blood pressure changes. Now let's talk about the macula. The macula is where we do 80 to 90% of our viewing, and it's where we do all of our color viewing. It's also where we see macular degeneration. Macular degeneration is one of the leading causes of blindness, and it shows up in the structure right here called the macula that we evaluate when we do retinal imaging. This particular patient's macula is absolutely gorgeous. No signs of any pigment changes, no signs of any drusen, a beautiful, healthy macula. So when patients ask me, should they do retinal imaging in our office? Absolutely, because we're going to take the time to explain to you, to go over, to show you where my concerns lie, and to show you that you're healthy and that we want to maintain your health going forward. My name is Dr. Martin, Auburn Optical, and it's a pleasure to see you.